Hey everybody, this is Professor Klein back in the Human Anatomy Lab at Ohio University, and today I'm bringing you a comprehensive video on one of my favorite models. It's the arm muscle model. I'm gonna grab a probe to use, but if you want to grab a piece of paper, a pencil, a pen, something to take notes on, this is really gonna help you out with the muscles of the shoulder, arm, elbow, wrist, hand, everything from shoulder down. So first off, let me bring it over and hold it up to where it would be on the skeleton. We're talking the scapula, clavicle, humerus, and as it travels down the humerus, gets to the elbow, the forearm, which has the radius and the ulna, and then down to the hand, which includes the carpal bones, the metacarpals, and all the phalanges. All right, and if I were to pop off the scapula and the humerus and the arm and bring it on over, lay it on down here on the table, you can see what we're looking at. Again, we got the spine of the scapula. That would be this portion right here, leading out to the acromion. This is the acromion right here. You can also see, if we flip it on over anteriorly, a little bit of the clavicle. So the deltoid originates on the posterior 1/3 of the clavicle, the acromion, and then part of the spine of the scapula as well. That's the origin. Down here, the deltoid tuberosity, that's where it's gonna insert. So it kind of all merges together. And where would that be? Right in here? Well, let's jump back over to the bone, and you can see it's actually about halfway down the humerus. Now, what's the deltoid gonna do? A bunch of different stuff, and let's break it down with each head. The posterior head is gonna do shoulder extension. You can see that right here. It's gonna do external rotation as well. The middle fibers, now we're talking about straight shoulder abduction. Those middle fibers right here. And in the front, flip it over for you, it's the anterior fibers, and it's shoulder flexion and internal rotation. Let's look at this deltoid on the skeleton. Here we can see it taped up, and we can see the three different heads. I'll start with the posterior view and the rear or posterior head of the deltoid. Yellow is the middle, and then we can see the red as the anterior. Look how long they actually go down to that deltoid tuberosity there on the humerus. But what do? Let's start with the middle head here. Watch and see when I pull up the arm into abduction. Notice how the yellow one scrunches up, and that means you are contracting the middle deltoid when you do shoulder abduction. And another thing to note is the phrase follow the fibers. What that means is that muscles will pull in the direction of the muscle fibers. So the muscle fibers are traveling vertically here in line with the humerus, and they'll pull the humerus into shoulder abduction. What's going on with the anterior here? Well, not so much abduction, but we've got shoulder flexion and internal rotation. You guys see those two? Let me do it again. I got shoulder flexion and internal rotation of the humerus. Final one in the back, rear deltoid. It's going to do extension. See how that scrunches up right there, extension. And watch the humeral head, external rotation, a little bit of external here going on with the rear or posterior deltoid. All right, enough of the deltoid. Let's pop this off and take a look at the underneath structures. Now you can see all the spine of the scapula and a lot of the rotator cuff muscles. There's 4 rotator cuff muscles. We can see 3 of them right here. The first is the supraspinatus. Supraspinatus coming over from the supraspinatus fossa to the greater tubercle. Down here, we got the infraspinatus, a pretty big one in the back of the scapula, also coming over to the greater tubercle. And then tucked number 8 here, the teres minor, it's coming over from the scapula over to the greater tubercle as well. What's this one? Well, it's not a rotator cuff, but it's called the teres major. Teres major. That muscle is called the little brother or little sister of the latissimus dorsi. It's going to do the same actions as the lats. What are those actions? Well, we'll talk about those later. Back to the rotator cuff ones though, and we can see flipping it to an anterior side, the subscapularis. This is the subscapularis right here. And it's going to do internal rotation because it's coming from the anterior side, and a different bump called the lesser tubercle for this muscle. And all right, let's go ahead and look at these yellow things here. What are these yellow things? These are nerves. I got a whole nother video on the brachial plexus and nerves, and that's what we call these nerves in here. But let me name them just real quick since we're on this model doing a comprehensive view of it. Now, if you look here, these are what are called the cords. And we have the posterior cord right here. We have the medial cord right here and the lateral cord over here. Now, the lateral cord goes into a nerve called the musculocutaneous nerve. That nerve is going to come down and innervate the biceps brachii, the brachialis, and the coracobrachialis, the muscles we're looking at. In the middle, you've got the median nerve. This one's going to come all the way down, follow with me here, to the anterior forearm and the thumb. Next, we got the ulnar nerve. See this ulnar nerve in here? I'll put the probe right on it. There it is. Ulnar nerve is actually your funny bone, and it comes down the medial part of your forearm and the pinky finger. What's next? Well, this one here is actually the axillary nerve. This one's the axillary nerve right here. It's going to come and actually posteriorly, if I take off the deltoid, you can see it pop out here and actually innervates the deltoid. And another small muscle you can see right here called the teres minor. That's the axillary nerve. Let me flip it back over though for you. What's this other one hanging down? Well, this one is the thoracodorsal nerve. Thoracodorsal nerve is another way to say it. And this is going to innervate the latissimus dorsi. So it's actually going to continue down and innervate this latissimus dorsi here. Other than that, there's an axillary artery, in between. Red is an artery, right? And that turns into the brachial artery and then splits into the radial artery and the ulnar artery, working their way down to the hand where you can see the superficial palmar arch and the digital arteries that expand up to the fingers. All right, coming back in here, this is an anterior view, and now we can see some of the brachium muscles, anterior brachium. This is called the coracobrachialis right here, coracobrachialis. This muscle is going to attach to the coracoid process, which is this bone right here, this bony landmark of the scapula. So imagine this muscle here being attached to this bony landmark, and it's gonna do shoulder flexion, shoulder flexion. Coming down here, we got the biceps brachii. Say that with me, biceps brachii, because it's got two. Bi means two heads to it. We got a short head, this one right here, and a long head, this one that goes all the way up. And really they're named after the length of the tendon. You can see the short head also goes to that coracoid process, but the long is going to go all the way up and through this area and attach to the supraglenoid tubercle. What is the supraglenoid tubercle? Well, if you bring this back in and you look way down in here, you see this little bump on the top of the glenoid cavity? That is the supraglenoid tubercle. There's also an inferior one. Remember that. We're going to use this one in a little bit. But the long head of the biceps brachii attaches to the supraglenoid tubercle. Okay, pop it off already, and let's get to the brachialis muscle. That's right, underneath your biceps brachii, there's a brachialis muscle, and this is it right here. It's shorter and only goes from about halfway down the humerus down to the ulna. So that's different than what we just saw on the biceps brachii. This is only going to flex the elbow. And I tell my students that a muscle will have an action only if it crosses a joint. So for example, the biceps brachii, it crosses the shoulder joint and it crosses the elbow joint, which means the biceps brachii can flex the elbow and flex the shoulder. But the brachialis, it only crosses the elbow, so the brachialis muscle can only flex the elbow. And let me put some forearm muscles back on here so that you can see the brachialis diving deep into those forearm muscles. We got the anterior forearm muscles and we got the posterior forearm muscles. But before we get to those, let me not get ahead of myself. Let's come back up here and let's flip it on over, and we're talking about the posterior side, a huge muscle called the triceps brachii. There's 3 heads, try 3 for this one. Now you can only see 2 of them right here. This is actually the lateral head. This is the lateral head of the triceps brachii, and the long head. See how this muscle is longer than the other one? This is the long head. Now there is a medial head, and the medial head would be wedged in here. I'll put a picture up on the screen of the medial head, but those are the 3 different heads of the triceps. Now the triceps are going to do, well, they cross the elbow because they attach to a bone called the olecranon. Go ahead and feel the back of your elbow. Feel this bony landmark right here. You guys feel that? Hurts to hit, don't hit it, but it's a really hard bony landmark, and it's called the olecranon, or you could say olecranal. And this is where all the tricep brachii muscles are going to insert into. So if a muscle inserts here, like my finger, and I pull on it, see how it would extend the elbow if I pulled on my finger, because muscles pull. That's one of the main actions of the triceps brachii. But let's jump up from the model and jump over to this skeleton that I've taped the muscles onto. I love using tape in anatomy lab to show the muscles, because here you can see the lateral in orange, the medial in the middle, and the long in yellow. Let me push a few things out of the way so you actually can see that medial head in blue. They're all coming down to the olecranon, but now you can see more clearly the three different heads and that long head attached all the way up on the infraglenoid tubercle right here of the scapula. So what are the actions of the triceps brachii? Well, that long head, it crosses the shoulder joint, so it's going to have an action on the shoulder joint, and it's going to extend the humerus. See how that contracts when you pull on the muscle and it extends the shoulder at the humerus joint here? Well, down here, what do all of them do? Well, if I were to pull on it, they would do elbow extension. You see that? I'll zoom in. If you contract, it'll pull and produce elbow extension. That's the triceps. All right, now we're moving down to the forearm, and I got my own arm here for you to show what a real arm looks like versus the muscle model and the skeleton. These are all forearms in the pronated or palm down position. But if we swing this up here and we start to take a look, let's start with the extensor side. So we're on the posterior side here, and the extensor side, I'm going to do a 360 of it here. You can see it actually goes way lateral, almost to the anterior compartment. Anterior compartment would be up here. So right here is where it starts. And this is the brachial radialis. I'll put the name on the muscle, or elbow flexion is the brachial radialis. Next up, right next to it, you can kind of see two muscles together, and that's the extensor carpi radialis longus and extensor carpi radialis brevis. Look at that brevis, number 21 right in there, right next to the longus. Those are gonna go down to the wrist. And if we look at a hand model here, I got another video for the hand if you want to see everything in the hand, but we can see these tendons coming through. Now the most lateral one is the longus, and the most medial one is the brevis. But back to here, and we're really working our way lateral to medial, and in the middle, let me get the probe again, in the middle, number 30, going all the way down to all four digits, 2 through 5 here, is the extensor digitorum. 30 is the extensor digitorum coming down. That's going to extend the wrist and all the joints of the fingers. Not the thumb though, just digits 2, 3, 4, and 5. But you'll notice 31, kind of a sliver of a muscle right here, coming down. 31 is the extensor digiti minimi. This skinny narrow muscle here is going to come out to the pinky finger, and I call this the fanciest muscle in the body. Fanciest muscle in the body, because it allows you to raise your pinky finger. Like, next up, we got an extensor carpi ulnaris, which stops right here on this side of the wrist. Extensor carpi ulnaris. And really, if we look back over at the hand, let's bring the hand back in here. We're going this side, you can see right here where the insertion is for the extensor carpi ulnaris. That one would extend the wrist as well as do some ulnar deviation, or like this, where you bend your wrist to the pinky side. What's this last one tucked in here, number 33? Well, it's actually the anconeus, and that was included with the triceps up here because the anconeus will extend the elbow. Here, and this is the anconeus muscle. Now, what happens if you pop off this right here, and let's pop off this side as well? You can see a few more things. First off is the supinator, deep muscle that supinates the forearm. This is a supinator muscle right here. Kind of like the opposite of the pronator teres and pronator quadratus. Those muscles would pronate, but this one supinates. Then you come down here and you can see 1, 2, 3 muscles. So if I track those 3 out, notice how there's 3 different tendons. I'm gonna put some numbers on the screen so that you can see 1, 2, 3 different muscles right here. And they extend to various lengths in the thumb. So these are all gonna be pollicis muscles. Now what are these? Well, 35 is the abductor pollicis longus. It's gonna come out, and I gotta turn the hand here so you can see it come out and insert on the pollex and abduct the thumb. What's that look like? This is abduction. Abduction is taking the thumb way out here. So this muscle pulls it straight out. Next up, what's this next one kind of in the middle? Extensor pollicis brevis. And I'll give away the last one. The last one is extensor pollicis longus. And really that one's named after the longer tendon. So see number 50 here, it's got a 50 on it. That's the extensor pollicis longus, and it's going all the way out to the distal phalange. The brevis only goes out to the proximal phalange. They pretty much do the same thing, right? As they pull the thumb into extension. And whoa, look here. See that tendon sticking out? I'll throw up a better picture on the screen of this tendon. That's the extensor pollicis longus. You can see that tendon on your own self. Let me try the other hand. There it is. Extensor pollicis longus. Wait a minute, Professor Klein. There's another muscle in there. Let's take a look. There's one wedged way down in here, number 37, and this is called the extensor indicis. Indicis kind of sounds like index finger, and that's because the extensor indicis will extend the index finger only. And if we follow it up, so this one comes and it crosses over and it jumps up to here, this index finger. So I'll give you a better view of it right here. This muscle pops up from deep and goes all the way to the index finger. What's the nerve going on back here? Well, everything posterior, say it with me, everything posterior is going to be radial. Radial coming down, radial coming across. This is radial for the posterior forearm. All right, we're going from a posterior view to an anterior view, but I want you to see that there's, some overlap here where muscles are reaching to the other compartments, but this in here is the anterior compartment. We call these the flexors of the wrist, the flexors of the fingers. However, not all of these are flexors. We're going to look at the first one here, number 22, is the pronator teres. Pronator teres. This one's going to pronate the forearm. So it is not going to do anything at the wrist or the fingers because it is stopping right here. It's just going to do pronation of the forearm. The next one up though, 23, this is the flexor carpi radialis. No longus, no brevis on this side, just flexor carpi radialis. It's going to come down and stop right on the thumb side, but it's going to stop at the carpals. But bring the hand back in here, and we come over to the anterior side. This tendon right here is your flexor carpi radialis. It dives deep underneath these muscles. Let me see if I can go even deeper with it. And it inserts into the carpal bones. Back to here. Well, what's number 24? This is a muscle that not everybody has. This is the palmaris longus. Palmaris longus here. Let me give you a better image of it here. There we go. 24, palmaris longus. This one's going to come down and stop at the palmar fascia. Let me get the fascia back on here. There's a little bit of it, of the flexor retinaculum. Next up in the forearm, let's keep going this way and let's get to this muscle. It's all the way on the other border, going from the elbow down to the pinky side, the 5th digit down here. And this is the flexor carpi ulnaris muscle right here. So that rounds out 1, 2, 3, and 4 superficial muscles. There's one layer on top called the superficial layer, and those 4 muscles compose that layer. Here's a picture of how to remember the 4 superficial muscles by grabbing your own elbow and putting your thumb underneath. And when you do that, you've got 1, 2, 3, 4 fingers right here. And the 4 fingers represent index fingers, your pronator teres. Then you've got this middle finger, which is your flexor carpi radialis. The ring finger, right in here, ring finger would represent the palmaris longus. There you can see the tendon. And finally, we're talking about the pinky finger, the flexor carpi ulnaris. And guess what? It's on the pinky side. So the pinky finger represents the muscle on that side of the hand. But what's underneath it here, if you look real close, you can see the flexor digitorum superficialis. There's a little bit on both sides. You can see it's labeled number 26 on both sides. This muscle is in what we call the intermediate layer, and it runs all the way down and out to the middle phalanges. But if I were to pop this off, I can see some of the flexor digitorum superficialis right here. See how it's divided? And I can also still see some of it right here, number 26, flexor digitorum superficialis. What's underneath the superficialis? Well, it's the profundus. And I'm talking flexor digitorum profundus. That's coming down this way, and it's going to be deep down here. And if I show you a hand model, and I pop this off here, and we can see underneath, we can see the flexor digitorum superficialis coming up and splitting. See that split? And then underneath this tendon would be the flexor digitorum profundus. So hand here as well. But there's another one wedged in here. It's labeled number 28, and it's the flexor pollicis longus. This one, you kind of lose it here on this model, but you can see the muscle belly. It comes down and it will flex the thumb. How does it do that? Well, on this model, you can see the tendon. Here it is, flexor pollicis longus, coming all the way down and reaching out to the thumb to produce flexion. And there's another one way deep down in here. It's 29, and this is the pronator quadratus. Pronator quadratus. Now, you really can't even see it on this model. If I jump over here, you can see a little bit of it down here. You can see a little bit of it going over here. The key with this muscle is that the muscle fibers are perpendicular to the forearm. So the muscle fibers would be coming in this way, allowing you to pronate. Let's look at that on the skeleton. And here we can see the black tape would represent the pronator quadratus. And if you contract this, it will pronate this way here. There we go, that's pronation. See how the muscle, the tape, is pulling the radius into pronation. So I'll show that again right now. Pronator quadratus, that black piece of tape right there. While we're at it, let's take a look at this pink piece of tape. The pink piece of tape is representing the flexor digitorum profundus because it's going all the way to the distal phalange here. We got another one over here. Come on over, lots of stuff in the lab today. And this purple piece of tape is the flexor digitorum superficialis because it stops at the middle phalanges. The big difference, and I'll put the other one on the screen here, is that the flexor digitorum profundus goes all the way to the distal phalanges, but the flexor digitorum superficialis stops at the middle phalange. And don't worry, I did not forget about the flexor pollicis longus. Here is the flexor pollicis longus coming out. And if I take the skeleton and I were to flex, let me see if I can do it. Here we go. Flex the thumb like that. That piece of tape, whoops, that piece of tape would produce that action. Now, pretty much all the muscles in the anterior forearm are going to be the median nerve coming down here. Median nerve, here it is, median nerve coming down. It stays on the thumb side, and you can see it takes up a majority of this compartment. However, we also have the ulnar nerve coming down and going to the pinky finger. The ulnar nerve is going to hit actually one muscle of the anterior forearm, and that is the flexor carpi ulnaris. You can see that right here, this big muscle on the pinky side. That is going to be the ulnar nerve. Everything else median. More shown on here is the axillary artery in between the brachial plexus. Coming down, it turns into the brachial artery. Right in here, it splits into two arteries, and let's follow this one down. This one's coming down to the thumb side, so it's the radial artery. But the other one goes medially, and this would be the ulnar artery. So if you ever take your pulse on your hand, this would be the radial pulse. I'm not gonna cover everything on the hand because we got another video on this model which gives you much more detailed hand muscles. But over here you can see a few. Now these are the thenar muscles. Thenar mean thumb muscles. Hypothenar, we're talking about the pinky finger muscles. And really you can just see a muscle called the abductor digiti minimi going to the pinky finger, which would abduct the pinky finger. All right, but also on the thumb side over here, you can see a few of them. Number 40, the opponens pollicis. 41, we're talking about the abductor pollicis brevis. 42, we're talking about the flexor pollicis brevis. And deep down in here, 43, we're talking about the adductor pollicis. And we can even see 44, a lumbrical. Got some lumbricals in here. Lumbricals would be in between each of these tendons, as the red part coming across is the superficial palmar arch leading out to the digital arteries. You got arteries wrapping around each of your fingers. You got the flexor retinaculum, number 46 right here.